Let me start with the issue of ROI. I think the industry set very high expectations that these programs would produce a positive ROI. And for those unfamiliar with that term, ROI stands for return on investment. And what that means that if you give somebody $1, you expect $3 back, which is a 3-to-1 ROI. Now, people who are doing that are usually on Wall Street. Those are the traders. But in the healthcare environment, when was the last time you gave a healthcare provider $1 and you got $3 back for service that he or she delivered to you? Now, whether that provider is a hospital, a physician, a pharmaceutical company, a device manufacturer. So no one really expects an ROI from the traditional ways in which we deliver healthcare services. And yet, in the health promotion, disease prevention, wellness arena, there's this expectation of a positive ROI. And I don't think that's fair. I think also the industry has set itself up for these kinds of expectations. We're going to get money back for everything we do. And I don't think that's the right metric. So a better metric that has evolved over the past several years is something called VOI, which is the value on investment. In economists' lingo, what that is essentially cost effectiveness of an intervention. So if you're trying to get people to lead healthier lifestyles, if you want them to be more energetic, to eat healthy foods, to not smoke, to manage their stress, blood pressure, cholesterol, glucose, triglycerides, and all those things, what's the most cost-effective way of getting there? And there's certainly medical interventions, but there are also behavioral interventions, and there are even organizational interventions that probably give you a lot more value for your investment and have a lot of spillover effects into other areas that are of great interest to corporate America. So I would put things into 4 big buckets. The first and important bucket is population health improvement. So if you've got 100 people in your company or 1,000 or 10,000, to what extent are you able to improve the health and well-being of those people? And the more the merrier. So if you've got 100 people, you can't just improve the health and well-being of one person. You really ought to be aiming to improve the health and well-being of all 100 people. So getting people involved, engaged, participating, doing it in an enthusiastic fashion, and moving their health and behaviors in a positive direction, that would be the first set of metrics. So again, things that I mentioned a minute ago, getting people to be physically active, to eating healthy, managing stress, managing their biometric values, lowering their weight if need be, blood pressure and so forth. Those are the first things you want to look at. So that's the behavioral or risk factor bucket. The second is a healthcare utilization and cost bucket. And there indeed, what you want to do is manage healthcare utilization and costs. So what does that mean? Admissions to the hospital, ER visits, doctor visits. And by the way, there are good doctor visits like preventive service visits, and there are bad doctor visits like, something bad just happened to me. Drug use. So those are metrics, and most companies in America, especially the large ones, actually have access to their healthcare utilization and cost experience. And you can look at the trends and look at whether you're essentially bending the cost curve in terms of healthcare utilization and costs. Third big bucket is productivity. So that's a broad area. It involves obvious things like absenteeism, disability, workers' comp, safety incidents. But then there are some other areas that we're beginning to get our arms around: on-the-job productivity and performance. And there are now instruments that measure that. They're in the category of presenteeism instruments that look at the effect to which health and well-being affect your performance and productivity at work. And then finally, I think there's this other category called other. And what other is reputation, morale, corporate social responsibility, the ability to attract and retain talent, where you are on the list of companies that people admire. That really, those are the companies I want to go work for. And by the way, that's important, especially today in the knowledge economy. When Google is competing with Intel, which is competing with all of these other developing companies, where really what you want to find is the smart and creative engineers and get them to come to work and really love what they're doing. How do you get those people in the door? How do you keep them in the door? And one way to do that is to create a healthy company culture. I don't think it'll ever disappear because businesses make investments, and everything they do, whether it's machinery or training or acquisitions, they are looking at the business rationale behind those kinds of investments. Therefore, they always are looking for an ROI. Now, in many other areas, it's hard to quantify that. In this area, I think if we expand the view and if we look at some of the things we talked about, and especially if you ask senior management of a companies, they will recognize ROI and VOI in many ways are inseparable from one another, and they're equally important. Now, I've been conducting ROI studies for the last 20 years, and there's evidence out there that if done right, these programs can achieve a positive return on investment. I've seen it, I've documented it, I've published on it, but I don't think we should be setting that expectation because documenting that is actually hard to do, requires a lot of time, effort, data, and money, and expertise to do that. So if we set that expectation for every company, I think it's going to be hard for us to achieve that.